practical?
Yeah.
Cool. Cool. I'm taking a few minutes before I'm starting to share we can find a room, but if it's a real small group, we can have it really more. Sorry. If it's a real small group, we can have it more of a discussion based. One of the things I forget to say is this is all being filmed, and so I get a little concerned about people's confidentiality. It's helpful for me to know what chromosome condition you're dealing with, but certainly feel free to not use your son's name or any other thing that would reveal confidential information. Hi, how are you? Good. I'm great. You've been in child care last weekend the whole time. Oh, fine. So now you want to go do more practical things? Don't you want to go to the spa or something?
Yeah.
Point me there. So I know some of you guys were in the one yesterday. What I really want to know is, would you prefer that I finish what I started yesterday? Start from the beginning, maybe go faster through the beginning and slower through the end? Or would you rather have it be discussion-based kinds of format? What would be most helpful?
We were next.
Okay,
So just like quickly, summarize. Yeah, and we're fast. Yeah.
Okay, well let's go ahead and get started then. Okay, so this is me. For those of you that don't know me, I work at Children's Hospital in Denver in the Extraordinary Kids Clinic with Dr. Tartaglia. Couple of quick caveats. We do clinical evaluations. Many of you know that because you've been to see us. So people come with clinical concerns. I have a little bit of a skewed view because I mostly deal with kids that are really having a hard time. But I think one of the reasons a lot of people come to our clinic is because I give practical solutions. I'm interested in hearing what works, what doesn't work, and I try to recommend things that are more practical rather than maybe inaccessible. Also, I'm trying to, in this talk, I'm trying to cover all the X and Y conditions, and I'm trying to cover all the ages. So it's a bit of a tall order, and I know that I can't necessarily cover everybody's needs. So hopefully this time around we can leave more time for questions. Okay, so these are the 12 concerns that when I really thought about it came up in our clinic. But also I did think about things that have been covered better elsewhere or are generally covered well in treatment, like ADHD and some of those kinds of things. And I know I have a request to cover obsessions and compulsions in a little more detail, so I want to try to get to number 10. So these are the things we see a lot. These are the things that people, parents in particular, want practical solutions for. So learning is probably the number one biggest issue we hear people are struggling with. I'd like to suggest that people think about what makes school hard for them, for their kids. And I think it's language-based issues are one of the biggest issues for a lot of kids. And yet, I don't think our kids are necessarily classic dyslexics. I think it's language-based learning material that tends to be the most difficult. And then the big issue is open-ended work, organization, things not being structured for them, and the socially loaded environment of school. So these are the big issues: language, kind of that organizational piece, and the social piece. And so when you're putting together your IEPs, these are kind of, for me, the things I like to see people try to address. Sensory written work is the other big issue. A lot of kids, when you look at where they stop working, it's with written work. And then this challenges the stature thing is a lot of time, especially for boys that are diagnosed later. Nobody's been accommodating their stature, and I see boys trying to work at little tiny desks, especially in high school, and they're slouched over and nothing fits them, and it's tough.
Could you go back to that for just a second?
You bet. There's also copies at the front desk of my A lot of people were asking for them. So I think they made some more. And also, they took a copy of this to put out to everybody.
Oh, correct.
Okay, start with the IP. Visit your school, get to know your school well, get to know who to work with and who to avoid. I think this is important. Have some friends at school, people that can give you the inside track. Work sooner rather than later with people that are going to provide one-to-one help for your kid. When I did a study on Fragile X, and it was a retrospective study, and I asked parents what was the most helpful. Single most helpful thing for those parents were OTs. That was the big one. But anyone who worked one-on-one, least helpful were people like me, psychologists. Okay, but I think we have something to offer. Plan for transitions ahead of time, yes.
Just wanted to, and I don't know.
I'll put all these out so you guys can start writing
notes about this, but ask, one of the issues we face with the OT in the school system is they say that they are supposed to be focusing on educationally focused goals. And we keep trying to say, well, sensory is an educationally focused goal.
Absolutely.
But they're not, because we really wanted to build in where his day began with a sensory diet
Right.
in the morning. And we're really having a hard time getting them to cooperate with that. And I'm wondering if you have any suggestions on
Right.
how.
That's a hard one. It is in our state as well. First thing, get an evaluation from a good OT. Somebody that the school respects and knows. Well, maybe not knows, but respects.
Right.
Don't use the word sensory integration.
Okay.
Use words like adaptive skills to complete academic work. Use words like life skills. Use words like, use things that school does need, like hit the handwriting. Say that and make sure that your OT says that in the report. And then try to educate your school about sensory integration and how it can make a difference. This is a huge issue right now, trying to get sensory integration into the schools and try to get it in every day. The other thing I've seen parents do is see their private OT before school rather than after school, so you get the benefit of OT before school. A lot of OTs don't work at 7:30 in the morning.
Has the law not broadened? Because my understanding is that with IDA, the law broadened to say it doesn't have to be just education.
Absolutely. Legally, you're on good ground, but
Convincing them is
it is. So try to reword things so they're academic rather than sensory-based, and sometimes we've had luck with that. The other thing you can sometimes ask for is a trial, especially if you can get an OT working with you. Ask for a trial of 2 weeks or a month of sensory-based strategies at the beginning of school, and see if they'll accommodate at least a few weeks, and then log carefully behavioral incidents. Did you get a reduction in meltdowns? Did you get a reduction in aggression or whatever? So get a nice time beforehand and log it during your trial and log it after your trial. And the law says if you can show positive impact, then they should support it if it's within reason. Does that help? Does anybody else have any helpful hints how they've gotten SI in schools? The other thing you can do is be sure to do transitions before kids or after kids. I think one of the worst setups for kids is trying to transition with everybody else. So everybody's getting off the school bus at the same time and everybody's going through the halls at the same time. If you can, and they usually will accommodate this very easily, have your son or daughter come in early or come in a little late. So everybody is either already working, but for a lot of kids that's anxiety provoking, or he can come in before everybody else, kind of get started, get his place, get his stuff set up, and maybe even put on headphones and a baseball cap while kids are coming in so that they can tolerate that sensory overload of the transition at the beginning of the day, midday, and at the end of the day, or during recess.
I think with high schoolers,
Yeah.
that's a tough one.
It is a tough one.
They have to just move along and,
Right.
sink or swim.
That's true. That's true. Although sometimes schools are more willing to accommodate transitions before getting hall passes, basically, they have that system in place, the hall pass system. They're willing to accommodate with a hall pass, whereas sensory integration can be a big step for schools that don't have sensory strategies in place. But I agree with you, high school, as the years go up, it gets harder. That's why for you guys with little kids, get it in place now, show that it works, and carry it on to your next school. For our boys that are later on diagnosed and beginning to have escalation of problems in high school, Aaron actually talks about how he got his school to accommodate him to come in late, to take breaks, he had naps. He had a tape box, a box taped out around his desk so that he could get up and move around a little bit. Well, he can tape it, but it's a box that he could work with. So he asked for a chair at the back of the classroom so he could stand up. It helped. So these are some of the things to consider when you're planning your IEP. I'll go through this quickly. Anybody have any specific questions about it? Make sense?
The note-taking,
Yeah.
that's our huge problem.
Right.
That's the whole key to his success or non-success.
I think it can be for a lot of kids.
Many
want
teachers say, if you want to go to college, you got to take notes, no matter what. And
Is he on an IEP?
yes,
Okay.
but
They should accommodate
many
it, right?
teachers still don't accommodate it and don't want to call attention to them and don't have the time to give them notes. And it's
They can't copy theirs.
sometimes they don't. Yes. No.
That's when you have to just stay in their face and keep asking more.
Right.
Yeah.
So the things-
Nicely, just keep asking.
Right, and ask for specific things. The things that typically people ask for are course outlines. They ask to record the lecture. They ask for him to be able to highlight an existing
Right.
course outline, so that, because a lot of teachers say, well, my outline, I do it different than my outline. But a lot of times they hit the key points, and then your son can just highlight the areas that they did cover. It's
It's
huge
an
issue.
uphill battle. It is.
The other thing, have you got accommodations for using a keyboard?
No, because he calls attention too much to himself and he wants to,
Play games on it or whatever.
he gets
So
distracted
Alpha-
and he also, I'm sorry.
Alpha Smarts work, most schools will
Yeah, he's
accommodate
had it
it.
when he was in middle school, but now he's in high school and he wants to try to, blend in.
Sure he does, yeah,
And
don't.
not call
yeah.
attention because kids pick on him, but,
Right.
and I don't want to stop you, but that's our huge,
It's a huge issue.
yeah.
I'm going to try to move faster through this part. So get your kid involved in the process. One of the things that has helped a lot is to teach kids to say, it's too many words, show me, let me help you teach, can I do it a different way? I talked yesterday about breaks and break tickets. You can implement a number of ways for kids to ask for breaks that aren't humiliating, not raising their hands or talking to the teacher. One of the things that has worked is either a stack of break tickets that they can use, as long as they use them appropriately, to ask for a break. Kids that need help can have a card on their table that's one color on one side and another color on another side, and turn it over when they want help so the teacher knows, oh, I see your card's turned over, I'll come help you in just a second. So, especially for kids that are anxious and have language-based issues, they're not going to raise their hand, they're not going to ask for help, they're not going to go up to the teacher and ask for help. Movies and books, I talked a little bit yesterday about how movies can really support reading. It can do a number of things. It can keep your child in the realm of what other kids are learning. If you give them the movie for the book that the rest of the class may be reading, it can support comprehension of reading material. But the other thing is you can have a conversation easily with your child about the material in the book. And I love it when kids argue with what's in the movie and what's in the book. Yeah.
I was going to say, when I taught first grade, I had a lot of sensory integration issues in my class. We did the taping so that people were listening to the book as well as reading the book. So you had the
great
dual support, and
Great
it made a
idea.
huge difference. Because first of all, it knocked out the other noise,
Right.
it focused on the lesson, and
Right.
never regretting it.
Right. So if you can ask teachers that are reading a book in class to tape it at the same time,
Or
then
if there's a
someone
tape
got it.
available from the library.
Or if there's a tape available from a professional reader. But sometimes the teacher reading it makes it even better because then the teachers oftentimes will say, oh, look, here's the spelling word that we had today, you know, and that's nice for them to have. But then you can reinforce it at home. It can be a bedtime story instead of what else you do. Yeah.
Textbooks on tape is really good too, because my
Thank
son
you.
would listen to the textbook as he was reading it,
Right.
and then suddenly he was able to comprehend.
So Readings for the Blind, is it readingsfortheblind.com or .org?
Most school districts have them.
Right, and school districts have them for their textbook curriculum, at least the larger school districts. But the other thing is if your child is asking the teacher for a movie on their book, oftentimes then the teacher thinks to use a book that has a movie form. Otherwise, the teacher may not think about it. And there is oftentimes movies for little kids' books too, like Purple Crayon, Harold and the Purple Crayon, Velveteen Rabbit, Bridge to Terabithia, those are all movies. And then teaching young children particularly, finding a way to ask for help. But even for boys going into college, finding a way to ask for help, and for girls as well, is really important. So work with your child to find a way that works for them. Yeah.
At what point are kids, my son's only 7, getting sort of a designation so they have more time for tests?
Oh yeah, and that's somewhere in here is more time for test. I would do it when you get an IEP, ask for more time. It doesn't hurt. If they don't use it, they're not analyzed.
Ours says as needed. So like if the teacher finds them struggling, they'll let them take this test outside of the classroom.
And what grade did you do that?
We probably started it when they started taking tests.
Yeah, when time tests start, and you know, there's mad minutes that start in first grade.
Skip my son, they didn't have to take them.
Skip, and that's the other thing, being excluded from high pressure kill and drill kinds of activities. Yeah. All you have to do is say in the IEP, no kill and drill activities, and they're like, okay. I could spend a whole hour on reading and spelling interventions. There's other talks on this. I'm not going to go into it in detail, but I like to give parents a basic idea for those of you that don't see problems in your little guys yet. You want to watch for an emerging reader by first grade. Yeah, good, okay. And a reader by third grade is the basic guideline.
What's an emerging reader look like?
They're just beginning.
Cat in the Hat?
Yeah, basic word identification.
Interested in words, interested in books.
Yes.
Looking at letters, recognizing words on signs as you drive down the street.
Yes, yeah, right. Stop, Mom, it's a stop. But at 6 months behind, I would be monitoring my child. Now, for kids that are already diagnosed with developmental delay, this is going to come on more slowly. But I really like parents to have a basic guideline as, well, you know, when are kids supposed to read? It's a little lost for some of us these days. I put up Orton Gilliam and Linda Mood because those are two of the most recognized, solid, good interventions for kids with language-based learning disabilities. And parents tell me, no?
No, we were just talking about Linda Moon because I checked into the Linda Moon and I was just telling her my son's developmental pediatrician said it wasn't for him.
Okay.
So it was just for my
And there can be huge conventions about this stuff. But these are two strategies that parents that I've worked with said, you know what, they really did work, they're really solid, they've been well researched. The other thing I wanted to put up is that most of the kids we see with X and Y differences are visual spellers. So one of the things that will happen when you get evaluations done is your teacher will say, I don't get it, you got this word, it's really hard, but you didn't get this word, it's really easy. It's because our kids can spell what they've seen a lot. In high repetition words, they seem to be able to spell well. Low repetition words, they don't spell well. So use that to your advantage and be sure to present repeatedly the 100 most frequently used words. There's a list online, easy to get, and get those in front of them quite a bit. I haven't even gotten close to OCD.
I just want to say
Yeah.
I've used Sylvan and I really like
Has it been helpful?
It's just in LA hard to drive there and
Right.
expensive.
and it's expensive.
Very.
They tend to do well for the material that they're working on. I think it's a great way to give your kid kind of added one-to-one attention. I actually think the Sylvan classrooms are what, in some ways, we would like to have. They're quiet, lots of one-to-one attention, you go at the child's pace. The problem is it doesn't teach, they sometimes don't work well with kids with developmental disabilities or more severe language-based learning difficulties. They do well on their own tests, but they don't transfer well to the school. So you'll see lots of improvement on their tests, but whether it transfers well to school can be a mixed bag.
On that note, I have my son who's KS, voice and XXY. He is 9. He is in the Kumon Learning Center.
Yes, there's
Have you heard of them?
Yeah.
And so far so good. I mean, it really is supposed to stimulate the frontal cortex, and
Yeah.
there's repetition, and it's given him a lot of confidence in
That's
not
really
just
important.
not melting down during taking like doing math, or not
Right.
melting down during comprehension and writing. So he's doing reading. I've got to do 2 classes: the reading and writing, and the math. And so far
Right.
so good.
Good, and that's, I think you use what works, and also you use, I think, what doesn't expend too much of our parenting energy. And sometimes we need, co-parents, people that will help out, because otherwise it just becomes very intense. And one of the things I'm going to talk about next is, you guys want to talk about this?
Well, I was going to say one thing about the
Okay.
timeline, the emerging reader at
Yeah.
the first time. My experience is that what the school's expectations are can be very different from what a developmental perspective is, because
It's a good point.
so many schools are now so test-driven with the standardized testing that they are expecting a first grader to have not only reading but comprehension, because that's what they're being tested on.
Right.
And so if they're lagging behind their peers, whether it's appropriate developmentally or not, they get in trouble and feel terrible about themselves, even if it might not be so horrible from
It's
a
not that
big
far off.
picture.
Yeah.
Yes.
Right.
But they're, my own son, they told me a week before school was out that he was going to fail if he didn't go to summer school. I knew he was struggling all year and then tried to get accommodations, but it was that whole testing thing where, everybody else is doing this and he's not, so he's going to fail.
Right.
You know?
And they want to get their scores up.
Right.
Right. Let me just quickly say, handwriting is a huge issue. I really think it's been kind of overlooked in some of our X and Y work. We need to understand it better, because when and I'm going to get to meltdowns in a second, one of the triggers for meltdowns are kids having to do fine motor work and handwriting. I think the big message I'm hoping everybody gets is using your kids' strengths, and your kids' strengths are visual and being involved in the material in whatever way they can. Their weaknesses tend to be, not for everybody, but tend to be more verbal and tend to be working with verbal material. And sensory and social. Those are the other big triggers. And so I would urge you to accommodate handwriting. If you see that as a problem, get your kid on keyboard sooner rather than later. And one of the points I like to make about cursive versus print, it was very popular to go back to print for a while. You can't read cursive if you haven't learned it. And our kids are visual enough, they need to see all the variations of the cursive letters and understand that so that they can read it and be really functional with cursive. Beyond that, I would certainly remove any penmanship expectations that may be and usually schools are fine with that. Handwritings Without Tears is a good curriculum. I like it. It's a good solid curriculum. The other thing about instant messaging will teach a kid keyboard like no other tutor system. Obviously, you want to, it needs to be instant messaging, people you approve of, and Facebooking the same thing. But this will really teach fast keyboard skills, especially if you get a really good conversation going.
Not great for spelling, though, is it?
No, not good. But we have spell check for that, yes.
Yesterday somebody mentioned a particular type of keyboard, and I didn't write it down.
Alpha Smart.
What?
Alpha Smart.
And what is that?
Alpha Smart. He said Apple Smart, but it's,
Oh.
I think Apple's have their own version, but Alpha Smart's the one most school districts have. It's just a keyboard with a few lines of print in LCD at the top. And it's interesting that he brought it up because obviously it was really helpful to him. The reason why schools like it is it's not a computer that the kids bringing into the school where they could do other things with it. It is just for typing, and then they plug it into a printer and print out their work, and it can totally and efficiently go around note-taking, handwriting, those
Is it a
kinds of
regular
things.
keyboard like that one is, or is it a different type of?
It's a full keyboard.
Oh, it is a keyboard. So they have to know where to keep it.
Right.
That was a real struggle for my son.
Yes,
Learning
keyboarding
It took him 3 years.
to keyboard.
Yeah, 3 years.
So for you guys that have little children, get keyboarding going sooner rather than later, and I would get it into the IEP just as soon as you can. It's really important. And you can use our documentation from this conference or whatever to say, kids with extra X's and extra Y's have handwriting difficulties. Let's solve it now rather than later. Yeah.
What about the times that you're talking to the microphone and then type screen?
Dragons. That would be a good system. I think it's still, I don't know, do your
Doesn't
kids
sound
have
good to
assistive
me.
tech?
Because you should just.
You need to learn the keyboard, it's one thing you need to learn, but it's not, I think there have been some programs that are just beginning to work. They're like the size of a cell phone, and they will, they'll recognize auditory input, they'll recognize typed input. It can get around some problems. So far, I've seen more technical problems with them. They're not quite smooth yet. But I think that's coming. I think soon it will really make a big difference. Yeah. Oops. All right, we'll go back to this. Anybody want to talk about homework? What?
It's torturous.
It's torture. Right. So one of the things I talked about yesterday is here's what happens. Your kid goes to school, they don't get their schoolwork home done, so the teacher sends it home, and then you fight with your kid about it. It doesn't get done, and so now there's more work to be done at school, or your kid doesn't even turn in the work you did do, and it becomes this vicious circle of homework getting bigger and bigger and more fight. Talk to your teacher about what's going on. Stop the vicious cycle. Get on the same page with your teacher. One of the things that some of my parents are doing is texting teachers to say, we only got through 5 of this tonight. Is that okay? Are there some that you really want us to hit? Get some kind of communication system going with your teacher. Texting, messaging, phone, voicemail. Most teachers don't really want to be called every night when your kid is having a tantrum. That's really, they're probably not going to get that. But some kind of conversation with your teacher so that your teacher is aware of what's going on. The second thing I would do is find out what the priorities are. There are some teachers that are teaching through homework. There are some teachers that just want review of the material. There's some teachers that are asking you to finish work at home that didn't happen at school. Figure out, okay, what do we really need to accomplish with homework, and see if you can get that prioritized and get it into your IEP. Consider a tutor so that mom's not the one being the drill sergeant. See if you can complete it at school. And then the other idea is there's only so much gas in the homework tank, and you've got to use it for what it needs to be used for. I really recommend taking the absolute amount of time that it takes to do homework every night and cut it in half. If your kid's spending an hour, spend half an hour. Yeah.
The best advice I got is homework was so bad, the meltdowns were so bad, that both teachers and the doctor said, I need to just demom.
Yes,
And
I'm
so
so
we turned
agree.
it back over to the school.
Yes.
Well, number one, I stopped helping him with his homework at home, because that's another 6th grade teacher says, nobody at the school is going to do anything as long as you're efforting so much at home.
You're teaching.
Really. So I let him just either do it or not do it. And within 2 months, the school was coming, he's not doing his homework. I said, well, what are you going to do about it? And that's where we got the tutors, and we got the accommodations on only having half of the work needed was done, and it had to be completed in some
It forces their hand a
No,
little bit.
it made a world of difference, because then when he came home, he didn't have that stress. He needed that downtime at home. And
They
he just
supplied the tutors, because we
No.
had to get our own.
No, they supplied the tutors.
So, Here's what I think is actually going on. I think a lot of our kids do better in a sensory sensitive environment with one-to-one teaching. So that's why it ends up at home, because that's the only way they can learn. They hate it, and I think they hate moms being their teacher. Yeah.
My son was overloaded looking at a paper of 20 math problems, so then he would only have to do one in row 1 to 5, and then move it down and do one for the next 5 or whatever it was. So definitely modifying the
Right, so
workbook.
half a sheet, or folding the sheets in half can help. There's another thing called windowing, which is you make a window out of a piece of paper and move it to what your child needs to be doing so they don't get so overwhelmed. I could go on and on and on and on about all these techniques. These are people, go to school, they get all this stuff. But what I'm trying to suggest here is change the homework battle into something that works for your kid. So I've suggested homework camp. Look, this is a problem. How are we going to deal with it? And institute a bunch of ways that really supports and help your kid get through the key pieces of homework. But sometimes I have parents write right into the IEP, no homework. It just isn't going to happen. Because our kids are going to school and look what they're getting. They're getting language-based stuff, sensory-based stuff, social stuff. It's overwhelming for them. They need to come home and get a break. That's what I do at the end of my work day. I don't know why kids have to go home and go to school all night too. So I really think it's a huge issue for parents. If we could take away homework, we could cut medications in half. Ours. Yeah, ours as well. So try to find some things that work. I'd like to talk about fatigue. One of the things we've seen in our clinic a lot are kids that have kind of unaddressed fatigue issues. And afternoon fatigue is something I hear a lot in a lot of the kids I see. It doesn't happen for everybody, but be aware that your kid may be at higher risk for afternoon fatigue issues. So what it looks like. I have started recommending afternoon naps or other ways to get your kid more rest. And I've actually had a few kids write it right into their IEP, and it has really helped. Surprisingly, I think to most teachers in schools, our kids are happy to be able to take a nap, and they take advantage of it. I've heard a lot of parents saying when he goes to sleep for 2, 3, maybe even 4 hours, and he goes sound asleep. For the kids I've worked with so far, and I really would like to hear more from you guys about how this goes, but for the kids that I've worked with so far, if you get in a regular nap every day, and it's a part of their life, they don't sleep so much when they do sleep. I think they're kind of chronically exhausted. We think this may be at the metabolic level. We think this really is a medical issue that we haven't yet been able to diagnose. Certainly the boys that have gone on to testosterone, and I always stutter when I say that, when they go on testosterone, they feel better and there's less of this afternoon fatigue, but there's still some. So I don't think it's testosterone alone, and these are kids that are pre-testosterone deficient, and they're having afternoon fatigue issues. So look at whether some of your tantrums and meltdowns are all in the afternoon and all when they're tired, and consider it.
But working double time compared to what a normal child works.
That's right. That's right. The other thing that works really hard.
Yeah. My son's 7 and I knew from when I was pregnant, and this is an area where I have so much shame around because we would, let's say, go to a family's house for dinner, and at 7 o'clock, that's when he hit. That's when he melted down. That's when he yelled at a parent. And I would scold him, spank his bottom, and now I look back and he was done. And if you have an older child and who can stay up till 8:30, anyway, these kids really need to be home by 7, you know.
They need it to shut down. And that's the other thing is early to bedtime. But I actually think sometimes they needed, I mean, if we tried an afternoon nap, we may get more mood tolerance in the evening, because I think they're really done. But if you can't do that, then try some things that help them, get more relaxation and more comfortable during the rest of their day in terms of fatigue. Yeah.
What you suggest with both times is also you have a medication drop off.
Yes, that's the other thing, the medication
Making
drop
sure you do
off.
homework and there's no medication left.
That's
And you're done.
That's right. So in terms of, we want to, I mean, a lot of our boys have trouble with core strength. It's a big issue. We're trying to understand it better. Give us some time. We're trying to figure it out. But try to do things to increase their core strength so that we can improve their posture and improve some of the ways they're sitting. I mean, I can't tell you how many patients come to our clinic and they fall asleep. They literally, 1 o'clock, X and Y nap time. They're sound asleep. Anybody, I'll go through the things that are important to people. Are daydreaming? Anybody have a problem with excessive daydreaming? Yeah, okay. Whoops. Let's do that. I think this is a coping strategy for a lot of guys. They're overwhelmed. Their life is hard, and they're daydreaming to get out of it. These are when I would be concerned and want to get further evaluation. You want to rule out, especially if your kid is daydreaming and can't be, daydreaming can't be disrupted, rule out seizure disorders or psychosis. And then identify the things that seem to be associated with daydreaming. Again, I think, and the reason I put this right after fatigue is because I think there's this afternoon fatigue daydreaming time. Now, here's what happens. Morning time is good, goes along pretty well. Then we eat a high-carb lunch, which is what most of our schools provide, and then we have a kid who's tired, a kid who's had now 5 hours of nothing but words, 5 hours of nothing but social complications, and they've been sitting in an uncomfortable school chair, and now we expect them to pay attention to geography or science, and they're not going to do it. And so what do most of the rest of us do? Like at this conference, we start daydreaming, So I think that they're trying to manage it the best they can. So I really encourage you, if your child's doing a lot of daydreaming, look at when they're daydreaming. A teacher oftentimes will say, and I get this all the time in my referral questions, the teacher says he daydreams all the time. Well, a lot of times they're not daydreaming all the time. Try to find out when they're daydreaming, and sometimes that can cue you to what's hard for them. Is it because they're doing handwriting? Is that during a discussion-based group? Is that during reading? Is that during this particularly mean teacher? Those kinds of things. So, if your kids having trouble daydreaming, try some of these things. Allow some daydreaming. They need it. And just think about when they do it and how long they should daydream for. You can use dream tickets for kids that have real intensive daydreaming problems. Dream tickets are the idea that a kid would have a few times during the day to actually go daydream. Use your daydream ticket, use your dreaming ticket, go to the library, check out a book, go for it for 20 minutes, then come back to class. Doodling, number 1 anti-daydreaming cure. So for those of you that are doodling, it really has been actually, I don't know if anybody heard the recent study, this wakes up your central nervous system, seems to engage our kids. And I'm not saying writing, but doodling, Tape boxes. Tape boxes are the idea of giving your child an area that they can stand up and move around. Usually it's at the back of the class. For little kids, we tape off an area on the floor. Sometimes it's a pacing box, so kids can pace. And because they're visual, if you give them a tape box, they work with that very easily. And it gives them their space. Also, sometimes tape boxes work for not touching other kids or other kids not touching your child, especially for kids that have tactile sensitivity. That needs to be his box. Leave him alone.
What is the tape box?
A tape box, you use masking tape and tape it off on the floor, a box, that kind of idea. Does that make sense? Yeah.
I have something just to share. My son was younger, kindergartner. He's very oral, and he's 9 now, so he's kind of gotten through all that, thank God. But one of the teachers came up with, and it was in, I don't know, OTPT, one of those wonderful people, came up with it was like a dog toy for him to chew on.
Chewies.
And that kept him from putting all kinds of other stuff in his mouth. And when he felt really oral, I gotta stick something in my mouth, he could stick that in there and chew on it or whatever.
It's interesting how much we end up talking about OT kinds of interventions for our guys. Yeah, chewies can help. I would urge people to try to think of things that are kind of socially acceptable so that nobody's making fun about what they're chewing on. And sometimes you can find keychains that seem like reasonable things to chew on that don't look too different.
Then they had a pad that was about like this, and had little knobbies on it, it was real soft.
Yeah.
And because he wiggles so much around the chairs, he's so skinny, the chairs are uncomfortable, they're not padded like this. And
Yes.
that just kind of, I don't know what they called it, but it kept him from, you know.
What do they call those in schools?
Cushion like a.
It's a cushion.
A sensory cushion?
Thick
Yeah.
sensory.
We call them OT cushions.
Wiggle seat. Wiggle seat. That's what it's called. Wiggle seat,
And
that's
that
what
really
it's called.
helped him too, so that was something else they did, so.
So the important thing for, especially for schools to understand, but for you as parents, don't punish daydreaming. They're just going to do it more. If kids are using daydreaming to cope and get away from a difficult life, if you punish it, they're just going to do it more. And you know what? This is something totally in their control. You can't stop a child from daydreaming if they're going to daydream, and you don't want to make it worse. Okay. Another huge issue in our clinic, and let me say right out here, I'm not going to stop the meltdowns, but I want to give you some ideas as parents as to when to really be worried. I certainly would be worried if you feel like your kid is losing touch with what's going on, if you're hearing things that sound like he or she doesn't understand what's going on. I certainly would be concerned if the duration is getting into 45 minutes to an hour. Be concerned if it's every day or more than once a day. Be concerned if the intensity is getting worse. Certainly aggression and destruction we're worried about. I would look at whether you feel like it's purposeful or accidental to the tantrum. When you're dealing with these things, you're looking at this list going, yeah, check. I'd really get a full psychological evaluation with someone who can do comprehensive evaluations of kids with developmental disabilities or other differences. So what do you do if your kid's having meltdowns? Log them. First thing, log them, get a sense of when does it happen, how often does it happen, how long does it happen. ABCs are antecedents, behaviors, and consequences. Analyze the tantrum. Figure out the best you can what is it about, so that the idea here is so that you can begin to manage those triggers. A lot of parents will say, all the time, we have tantrums all the time. Again, usually when you really look at it, that's not the case. Consider sensory issues. It's a big issue these days. Really think about, are they hungry, are they hot, is it at the end of the day? Is it every time he gets on my vinyl seats in the car, we have a tantrum? Whatever. How much are the language demands? Fatigue, frustration, is it around handwriting, is it around reading? And try to anticipate it and redirect it. Habit reversal is the idea of there are some things that don't work with one another. You can't be laughing and have a tantrum at the same time. Humor uses a different part of the brain than anger does. And if you can plug in some kind of humor, especially if you can catch them before they trigger, a lot of times you can head off tantrums. I also think a lot of our guys have a great sense of weird humor. The other thing is reduce and slow down your language. In the clinic, when we have a kid who I feel like we're walking on eggshells, I start by slowing down my language, lowering my volume, using simpler words to slow it down. That seems to help kind of redirect a lot of kids that are getting going. And teaching teachers to do this too, or paraprofessionals to do this with kids can really help. Giving it a name, this can help for adults and older kids a lot. If they have a name for I'm heating up, I'm getting too upset, but not saying kind of the typical things, but something that's more meaningful for them, like, storm's coming, I'm heating up, I'm about to go down the rabbit hole, whatever it is that can help you and your child and people around your child identify, you know what, got to change up this situation and go out, take a break, go to the bathroom, get a drink of water, something to change things. And model how to deal with difficulties. So one of the things that happens is our kids have a tantrum and we freak. Because we've all had that experience of the grocery store and the tantrum, and you know, we're only human. And that's our trigger. Or, okay, now listen, now you gotta, you know, and you start doing this, and you start talking really fast, and and that doesn't help. So trying to take a breath, keep calm, back off, give them space, use humor, shorten rather than extinguish tantrums. That's your goal.
So true. Legos, when they start getting the hard part, they hear it. Races.
There she goes.
Especially if it's 7:30.
Right. So, giving space is another point I want to make out of this slide. Really backing off, teaching teachers and paraprofessionals. Kids tantrum, the first thing they want to do is touch them. You know, back off. And especially during times, your kid may not even be upset. Your kid may be excited. And people want to hug them, or people want to touch them. Teach people to back off, especially if there's high catecholamines. You know, they're getting anxious or they're getting agitated in some way. Teach people not to touch your kid. And your kid can learn some nonverbal ways of saying, you know, something like that, that is like, oh yeah, I forgot. Or one finger up. Yeah, and that's right. And then teaching people to respond to it. You know, I got to put in my plug for my profession. I think therapists really can't help. Okay. Anxiety. One of the things that a lot of clinicians have a hard time doing is diagnosing anxiety, especially in children. They don't seem to know what it looks like, especially for kids that don't use language to express themselves. If your kid's going into a clinician and saying, I'm worried all the time, I'm scared of stuff, okay, most people know how to diagnose anxiety if that's what they're saying. But they don't necessarily go in and say that. So the kinds of things I look for clinically are perfectionism and intolerance for things not being the way they had planned. They're avoiding situations. Little kids are beginning to avoid situations, some kinds of things they just can't do. A lot of tearfulness, whininess, those kinds of things tend to go with more complex forms of anxiety. Kids that are anxious tend to be more rule-bound and routine-bound. Little kids, because may not be able to articulate these feelings, that you see more behavioral symptoms, more tantrums, more irritability, more fussiness, more whining. They tend to have separation issues, or maybe no separation issues at all, because they're so agitated, they're not kind of paying attention to who am I with. Stomachache and headaches. For older kids, these are oftentimes associated with anxiety. Yeah?
What about finger sucking? When my son started, we thought it was, you know, just a calming behavior. Now he's 6 1/2, and it seems to have just become a habit.
Is it thumb or?
It's 2 fingers.
2 fingers, yeah.
And he does it really only when he's tired and at home. Apparently he doesn't do it in school anymore, his teachers tell us. So it's not a public thing, but it's I mean, how much do we say, you know?
Here's my deal. Wow, it works for him? It doesn't hurt.
Yeah. Well, it hurts his, I mean,
It's hurting his
ask
teeth.
the dentist.
That's true.
You want to guilt
It's
trip
hurting
his
his
teeth.
Obviously, the nice thing to do is to provide him something else that works as well, that isn't quite as readily available, so there's a little bit more of a barrier. I actually think of all the things to worry about, that would be relatively low on my list,
Yeah.
but in part because I see kids with so much more.
Right, we don't have a lot of other
Yeah.
issues, you know, but he's
Right.
still young.
I have a
So-
question for you.
yeah.
Because my son sucked his thumb until he was about 16.
Oh.
And what we finally did was put the stuff on his thumb
Yeah.
that tastes really horrible. And he stopped, and actually we did that a few times, and no, actually he was given a dental device that would hurt when he touched his thumb. And believe it or not, he did it right through it. Then they came out with this stuff, it was now on the market, that you paint on.
Right.
And it tastes bad. And then within, I would say 3 months, he wasn't in at all. But he now has other obsessions. In his
Right.
place, so that's all I'm.
That's the thing,
Yeah,
is
yeah.
you tend to replace one one thing with another, and so you don't want the thing you replaces it with to be worse. So I've seen chewy tubes be used. You can do chewy tubes in warm liquid so that there's some sucking involved, there's some soothing involved in terms of warm liquids. You can do kind of thicker warm liquids. Sometimes they'll teach you yogurt so that he's sucking, and they like it, and it's not like you're punishing them. And sometimes then that will disrupt the thumb sucking, and they can find other things. What you want to be careful for any of the anxiety-related behaviors like OCD is once you're stuck on something, if you replace it with something else, you're stuck on that. And we want to move in the direction of things that are least harmful to be stuck on. Fingers are at the lower end of the stuck on list. Yes?
Can I ask you, one thing that is bothering my son lately, he's 22. He's always seemed to have a heightened sense of conscience. But like if he's somewhere and he does something at the time, it doesn't bother him. Then he'll start thinking about, should I have done that, shouldn't I have done that, shouldn't I? And all of a sudden he will get a headache, and then he'll come to me and says, Mom, I just have to tell you something. And then he tells me, and then finally it'll release. But he just said the other day, he goes, when is this going to stop? And
let's talk about that in OCD, because that's a trait of OCD, and there's a few things that can help. And here's the basic idea with anxiety and with things that kids get stuck on like that. Contain, externalize, and compete. And some people call it KEC. So this is the basic strategy for managing anxiety. Give your child a time and a place for whatever they're anxious about. So in the case of your son, you know it's so good that you're worried about doing the right thing. We have give it a name, worry time, talk time, whatever you want to say. At the end of the day, let's talk about it. Or if your son's out of your home, then he can call you at a certain time, and let's go over that. So he knows there's a time during the day that he's going to get to do it. It's the concept of containing it. It tends to help a lot. Externalizing it, give it a name, talk about it for kids that are less verbal, collage about it, draw about it, do sculpture about it, whatever works for your kid. And then do something that competes with it, and that is the ideas of relaxing or distracting. This is the yoga, this is the breathing, anything that would compete with anxiety. You can't be relaxed and anxious at the same time, is the idea. This is the basics of accepted approach for anxiety in my field.
Can I ask you?
Yes.
I'm starting to get to that thing where like some of my friends have this, and I have what the father should do and what the mom should do. So I'm thinking of when boys have anxiety, dads get really uptight and they get into the snap out of it mode sometimes. and they're not very, they seem like it can be like, just snap out of it. We're not going to talk and name it or relax. So do you recommend that the dads start doing this with the boys, like when they're 12, or do you think the mom, then maybe they go skateboarding or take a walk or take a bike ride? What do you think?
I recommend the people that are good at it do it.
Sweet kind mom.
When they get older, they'll choose who they want to call and talk to too.
What?
When they're older,
Yeah,
they'll go to who they want to talk to.
that's right. Then they'll choose who they want. But I also think families are families. We're all in this together. And I don't like the idea of this is your job and this is not your job. I think we work together. Now, also I'm practical. The people that are good at stuff tend to do it. I'm better at mowing the lawn than my husband. He misses spots. So I mow lawn. So you do what you do well, and I hope that the other partner and the other people in the home are also interested in helping out. And oftentimes you don't realize you're teaching your husband or your wife ways to work with your child without realizing it. Because if it works, people will pay attention to it. I hope that helps. I think you're right. I'd like everybody to be involved, but I really mostly want people that are good at it to be involved. Yes?
She wants to know if that
face is gonna end up. Someday, her son is 17 years old, and this is his most
Anxiety.
yes.
Is it going to go away someday? Is that
Yeah.
the question? In our experience, anxiety is one of the most consistent symptoms of XXY, and extra X's and extra Y's. It's hard for me to predict entirely. But it can be treated well with medication. It does help. So, the idea with parents that are dealing with anxiety is manage what you can manage. I think one of the real tasks I see working with families is you do what you can. And you may never get rid of anxiety entirely. But managing it and making life reasonable would be the goal rather than get rid of it.
Yes, my son came up with a unique thing where he does just get regular anxiety too, and what he started doing about 2 years ago is he carries an extra pill with him.
Yes.
That the doctor says, okay, if you get anxiety, you can take this.
Yes.
He hasn't touched it for 2 years.
But he has it.
Carries it with him wherever he goes. And he's able to, he goes, I pushed through it today, Mom, I didn't need it. And but just having it there is his safety net.
Is it propranolol?
No, it's one of his regular meds that he takes, and
just an extra.
have an extra one.
Could be a placebo.
That's what I
I was
was
just going to say, sometimes, not very often, but sometimes, and Dr. Tartaglia doesn't do this, but I've done this with other docs, they give a kid a Tic Tac and say, here's your worry pill. You can take it whenever you feel worried. And it can really help, because I think the idea is we're containing it and we're externalizing it. So the kid is like, okay, I have my worry pill, so if I need it, I can take it. And it's externalized. It's like, it's in my box and I can carry it anywhere I go. And I think that really works for a lot of people.
Do they know what it is?
Yeah, it's so
I was going to say, because this kid gets worried, all of a sudden he goes in and goes, Tic Tac.
Okay, so you've used something that they wouldn't recognize.
Well, he actually has the real pill in there.
And they're sugar pills. You can get sugar pills at the pharmacist.
But he went out the other day without it, and he couldn't go back and get it. And it was the perfect opportunity after 2 years of never using it. I said, well, just think about it. You haven't really ever used it, so what do you think the chances are that you're going to need it today?
Okay.
So I looked at that as maybe we're getting to the point where we can maybe wean ourselves.
So, right. So I think that's a good case study of somebody who's been able to take anxiety and experience managing it. And I think that's one of the lessons behind medication. Medication has allowed kids to experience life without anxiety. So a lot of times you can reduce or remove the medication and they have this history of behaving and acting as if there's not anxiety and they feel better. Yes?
The only thing I wondered is, since the anxiety thing has come up, I never really thought about it until this convention. What do you recommend for the X variations, Y variations, as far as there any particular one that works more for anxiety, as far as an anxiety pill, medication?
SSRIs, low dose SSRIs. Dr. Tartaglia attends in our clinic. We use Lexapro and Zoloft a little bit more. Zoloft being the more likely to use for anxiety. But every kid is different, and I'm a psychologist, not an MD, so I won't practice without a medical license.
You know the part of anxiety where the kid gets defensive and rude?
Yes.
And so it's very anti.
Yes.
So then the adults around him get a grudge and get,
Yeah.
What do you suggest with that?
Try to name it.
Name it.
Try to name it. Yeah.
Because people don't think it's anxiety, they just think it's a rude kid.
Yeah, right. And so if you can say to him, wow, that didn't sound so good. I wonder if you're feeling worried. So that he can link them. Yeah, let me say a little bit about worry time, worry box. I talked about worry time a little earlier. Worry box is the idea of taking all your worries, and you can do this with littler kids, but you can do it with older kids too. What I'm looking to do is find a way for people that have language-based learning disabilities to operationalize it, to make it something they can visualize. Because so much of the work in psychology is verbal. So many of your therapists, so many people are using language instead of something else. So you can make a box together and write the things that your child worries about or gets stuck on and put it in the box. You can also do it without an actual box. You can talk about it for higher functioning kids. And then you can take that worry box out at your worry time. Let's go through this. Let's go through all the things you're worried about and then talk about each of them. Oh, you're worried about not being to school on time tomorrow. What can we do about that? Let's think. What can we do about not being on time? So, and really take your time to slow down words. And kids that I've worked with love their worry time. It's so fun to do their worry time and go through their worries and kick out the ones that really don't matter and argue with them and find ways around the things that they worry about and get their worry list down to something that they can really manage. If you want me to go through this slower at the end so you can interpret, I'd be happy to do that. Thank you. Or, key points. All of the yoga techniques work really well for anxiety. They really do. The problem is it's oftentimes taught through a verbal means, more verbal than I think most yoga instructors would like to acknowledge. There's a lot of language, and so if you can modify them. How many people want to talk about depression? I know Erin talked about it. Erin and Zell both talked about it. Zell mostly, I guess, yesterday. I know this is a big concern. So let me say, we see this overrepresented again in X and Y differences, and I think it oftentimes is missed. And it's missed because the hallmark symptom of depression in kids is irritability and poor attention. And so kids get in trouble or kids get medicated for attention deficit disorder. One of the things I do carefully when people come to our clinic is look carefully at issues around self-esteem, hopelessness, and depression. In part because this is a treatable disease, a disorder, it really is. I also think a lot of particularly our boys, are just more mood sensitive. They're very sensitive and uniquely sensitive. In fact, one of the things, I think I make this point later, but I'll make it now. I really think that a lot of boys and girls with trisomiacs are uniquely sensitive to contrived or techniques or people not being genuine. They're very intuitive. Yes. And so people, when they think they're going to technique them, I'm going to do cognitive behavioral therapy, or I'm going to do whatever I'm going to do, it doesn't work. They can smell it a mile away.
Oh my gosh, my son's favorite expression is, yeah, right.
Yeah, right.
Yeah,
Exactly.
right. He's always saying that.
And when I'm doing testing, I have like things I'm supposed to say, they're like from the manual. And the boys I test hate that when I do it. I can see they're just like, yeah, she said this 100 times. They're so sensitive. And so I think we have to be aware that that can affect their mood in terms of feeling badly about themselves as well. I think it's probably more than that. I think it's probably very neurobiologically based. But I think they're uniquely sensitive people. But these are, I highlighted some things here that we don't think of typically as depression necessarily, or people that are less informed may not think of as depression. Like for example, in teenagers do risky behavior a lot of times when they're really depressed and trying to set themselves up for some kind of suicidal act they're not overtly suicidal.
It's hard to tell the difference between anxiety and depression.
Right, there's a lot of overlap. These are the basic ideas for treating depression. It's far more complex than this, but again, trying to do it all in an hour, which I'm now. All right. Did you guys want to have lunch today, or did you
This is way past 2 minutes.
Yeah, 12:15. Oh, I went on to Colorado time. Whew. So, identify and build resources.
I have a question.
Yes.
You mentioned that they don't do well in language based, so what should I tell her? What can I?
The language is hard.
I know, so what can she
So
do?
we do projects. When I work with kids, I do projects, I do
21.
collages. No, with my adults.
Okay, what if he doesn't like art, routine paid?
Then I would do activities, I'd build things, I'd do shoot baskets, I'd go for walks. I would,
That's not gonna work either.
activate
Like
it.
computers?
No.
What does he like?
He has no interest, other than video games.
Video games, he likes video games. Then I would, and I mean this, I would encourage the therapist to play a video game with him.
Can they talk while they're playing? I mean,
Right.
how's he gonna?
Right, he talks while he's playing, and then they can stop and talk about the characters, and talk about how good he is on it. And what I've done before is segmented times where we do some video games, and then we do some talking time. Time for our talking time, let's talk.
Okay.
I mean, that sounds infantile, but you make it, and again, guys are sensitive to this. You need to make a genuine connection with them. So I have to throw out all the stuff that I might have learned in school and really make a connection with the kids I work with.
Any fidgets,
That's fine, give them a fidget toy.
so he'll text right during his.
I'd give him a fidget toy so that he can be in, yeah.
I was just gonna add, I'm a therapist and I do sand tray therapy.
So it is 12.
And kids love, I mean, adults love that too. It's sand tray therapy where they use miniatures to create
Yes.
scenes in the sand
I
tray.
mean, I know what kind of therapy
That's
is
really helpful.
What kind of therapy?
Yeah. The physical therapy or just oral or?
Oh, for depression,
Yeah.
therapy like talking like a therapist, but play-based or activity-based.
Are you, as a therapist, taking a stand, you know, I'm just curious, on the video games, like, our voice should be more, like, stay away from them more than
Yes.
the DS and all that stuff?
Use your video game to get the things done that you need to get done.
Oh, as a, right, yeah, or
Yeah.
a bonus or.
I mean, I don't think it makes sense to take them away. This is the one thing that's really meaningful to kids. But I think limiting it and recognizing what visual learners we have and that they'll learn from doing. And they will learn from doing. And so I'm more sensitive to visual games in this population than any others. I would use it, I would think about what they're doing, choose video games that are more reasonable rather than less reasonable, and use it, play with them, comment on the video game, make it social. Those kinds of ideas. Use the we instead of
Use the we.
yeah,
Be
use
smile
the
is a really good one. Be smile.
Be smile.
It's all educational meetings.
Okay,
My son does not have a DS, he's 9, he does not have a DS, because I'm not going to play video games all the time. But a Be Smile I will, because he's learning. Wow. All these good,
Be
a
smile.
female smile.
Here's a door for
Sorry.
Sorry.
The German.
We need to anyway, let's talk about obsessions and compulsions. The idea is about obsessions and compulsions. People use obsessions all the time, and they say their child is obsessive compulsive. I would urge you to differentiate between obsessions, compulsions, and perseverations. Obsessions are the thought. I'm thinking about, and a classic is hand washing, thinking about whether my hands are dirty or not, I'm worried about dirt. That's the obsession. The compulsion is, I need to wash my hands. They wash their hands, they feel better, they get that feel better feeling. And then the obsession starts up again with, I need to wash my hands. And so then they do. And then they get their hands washed, and as soon as their hands are washed, the obsession starts again. Perseveration is something different. Perseveration is getting stuck without that anxiety loop necessarily involved in it. The only time that you, it's very confusing, and in psychology there's a big difference between perseverations and obsessions and compulsions. For obsessive compulsive disorder, you need that cycle of anxiety and obsessions, which are the thought, and compulsions, which are the behavior. So a lot of people will say my son's obsessive, and they're actually talking about compulsions. But there's a lot of literature out on obsessions and compulsions, but here's the basic idea. First of all, recognize it as a problem with your child. Say, look, hand washing is just not working. We're doing too much of it. Try to redirect it when you can, so you can catch it when it's a baby compulsion, if you can, and then build a vocabulary. And this idea is the idea of teaching your child that they're junk ideas. Yes, it's important to wash your hands, and it's important to put it away. And your brain is tricking you and keeping you thinking about junky stuff, because if we think about everything that we need to do, like washing our hands or checking whether the door is closed or checking the lock or whatever it is, our brain will get full and we won't do anything but that. So try to teach your kid, or have somebody teach your kid, to use some vocabulary so that they can wrap their brain around it. And this is important. I think what we tend to do is just say, stop it. And they can't stop. And if they do stop, they get worse. So that's the idea behind obsessions. Again, I could give a whole talk on it. I think it's really important for us as parents to not model compulsions. This is a tough one, because for parents that already have some obsessions and compulsions themselves, it's hard to not model them. But don't talk about germs and cleanliness if your child is prone to OCD. It's going to make it worse. And then the other idea is to practice. So we're not going to not wash our hands today. We're just going to practice not washing our hands for the next 20 minutes or 10 minutes or 5 minutes or whatever is doable. And this is an important idea. Don't practice. Don't do. Practice. We're just practicing. Not actually doing, we're practicing. Because the idea of extinguishing it entirely for a child who has OCD is absolutely overwhelming. And the second they sense, you're trying to get rid of this for me, it's real, it makes it worse. So we're going to practice it. So one of the things they're trying to do is get that just right feeling that they have right after they've washed their hands, for example. And that's what they're seeking, is that just right feeling. With OCD, what we're trying to do is tolerate the not right feeling to extinguish that need for the just right feeling. That's the basic
How
idea.
successful are you with this? It's hard, right?
It's hard. It's hard. Without medication, it's very hard. And I'm sorry, because that's what you raised, but it really does make a difference to get some medication on board so they feel better. Sometimes, if you can get acknowledgement around how disabling it is for them, then they will work to get better with it. It's really hard with little kids because it's hard to kind of conceptualize it without language. But here's what I did with a little boy who was fairly disabled. His whole thing was Legos, and he really needed to build with Legos. And so I got a Lego set, and we brought him into therapy. But he had to work and then do Legos. And we would practice not doing Legos. And we'd do a little bit of Legos, and then we'd take a Lego break. Until we could build it up so that he couldn't, we had the Lego set there, but he could go all session long without doing Lego time. And it eventually
I
went.
have a question about that, because my son is obsessed with Legos as well.
Yes.
And he wants to do it every day. He'll stay down in his playroom for hours on time doing it. But then he's obsessed with shopping for more Legos
Right.
and more, and that's all he talks about is what he
Legos.
wants next.
Right.
So
We try to practice not doing Legos.
like practice not doing it for a day. Or
Day
an
probably is too
hour
long
at a
for
time.
a period of time that you think he actually can manage. So again, take the most amount of time you think you can tolerate without Legos, cut it in half, do that, and he gets his Legos. Then do it again, and keep trying to increase it. And the idea is not to extinguish Legos, but to contain it during part of the day. So he has Lego time, and I mean, wouldn't it be a nice life if he could wait until after school, have an hour of Lego time, and then go back to life? That would be nice.
And that is what, and that would be the goal, to do that.
Right. Yes. Yes.
Well, you
What
can
is
explain exactly.
what did you mean by brain tricks and habit reversal?
That your brain is tricking you, and that's the idea of
Tell me
children.
it's brain tricks.
Yeah, his brain's tricking.
And what's habit reversal?
Habit reversal is there's some things you can't do simultaneously with your compulsion. So you can't relax and deep breathe and do your compulsion at the same time. So whatever the habit is, you try to do something that's competing with that habit.
Okay, what if he's not aware that it's doing it? can I do something like a certain code or something like that to show him that he's doing it without embarrassing him in front of people or?
You can, if you don't think this would be too humiliating for him, you can tape him doing it. And you know, say, you know what, this is really a problem. Can I tape you and let's talk about it? You can do that. You can give some kind of signal as to it's happening again. But I'll tell you, mothers are triggers in and of ourselves.
Yeah, that's a problem.
Yeah. And so a lot of times we moms have to take ourselves out of the loop and have somebody else do the work. We're a unique person in our kids' lives that trigger a lot of things, and I think we need to understand that.
So what do you do when it's happening? Oh, I'm the only one there.
And you're the only one who sees it, and it's not happening anywhere
Oh,
else.
it does, but I'm not there to say anything, nobody else is there.
Right, so that's when I would involve a therapist or a coach in trying to treat it. But it's tough, and it's really tough without medications, to be honest. I mean, I've just finally gotten to the point where I have to say, that's when I've seen some help, but it usually takes some kind of work in therapy and some kind of experience with medication to change the brain chemistry, to be honest.
He's brainwashing his medication.
Okay.
I'm serious.
That's, yeah.
His dad will do someone else.
So it's not you that's saying he shouldn't have
No, it's his
medication?
father.
It's his father.
That's
That's a tough
living
one.
with his dad.
That's a tough one. That really is tough. Let me say something. I have to catch a plane, so let me just briefly talk about perseveration. Perseveration is the idea of sticky things, and Legos are sticky. There's things in our kids' lives that are sticky, and trying to, again, do competing kinds of things like music or song or humor to compete with things that are sticky can help. You guys all know when you see something that's sticky. And I really encourage you, redirect your kid if you're heading into something that's sticky, so that your kid gets stuck on it. Again, some of the same concepts. Schedule sticky time. Use a sensory strategy to compete with sticky time if it's getting too sticky. Encourage private sticky time. If they can contain it to a part of the day, it oftentimes helps. If you can just get that far to contain it, you oftentimes can move it.
Can you give an example of what this is? I'm not sure.
Legos.
Sticky, they're stuck on
Oh,
something.
she said thoughts.
Snakes.
All the time.
Yes.
Everybody he meets. I have two snakes.
Yes.
I have, you know, always snakes. Jack's considered sticky.
That's a sticky. Yeah.
I didn't
That's a
hear
sticky.
that.
Snakes. He's stuck on
That's all he
snakes.
talks about.
Yeah, with our son, we have this thing where once he gets something into his head, like, he'll say, all of a sudden he'll feel, he's cold. And that's it. You can't get beyond that until an hour later, whatever. And he won't put on a jacket. He'll say, here's a jacket, he won't put it on.
It's not about the jacket,
No.
probably.
He's cold, or he's hungry, and that's all.
Right.
Food's coming. He's
And
hungry, he's
at this
hungry, he's hungry.
conference, you guys, if your child doesn't have this, you've probably heard some boys doing what I call sticky time. They're stuck on some idea or some word or something. Sensory things that compete oftentimes help. Oh, you know, like a sour snack, or a cold drink, or something that is sensory competing with whatever it is he's stuck on. So snakes, I might compete with it with something totally different, or the other thing we do is called sensory gradation, and I have a kid in the clinic who's stuck on something, I give them something similar. So if he's stuck on a snake, I might give him, I have this click it fidget, that's like a snake, but it clicks instead of, and so, look, this is kind of like a snake too. And then we get moved over to that, and then I move on from that. So with your son who's doing a lot of picking and things like that, it would be nice if you could do what he needs to do privately at a certain time of day. It's okay, you do it. I don't mind you doing it. That's the other thing. Anytime you say no to sticky things, it's going to make it worse. They're going to grab on harder.
I think the big problem is that he doesn't even know he's doing it.
Right.
So
So then,
it's kind of like.
may want to see if it's a tick too.
What?
Could be a tick as well.
Many of them really don't understand that they're doing it.
Right.
I don't
Right.
really think they do.
So trying to move it, contain it, and move it in any direction elicits more control.
So how do you make him more aware of him himself doing it?
If you're the only one who notices and he doesn't care, and it's not interfering with anything in his life,
Well, it's varying with social life, because some people don't want to be around.
right, then if he's doing it enough for other people to notice, then I would elicit somebody else to help him with it.
Oh, okay. Because they don't say anything, they don't want to hear it.
Sure, right.
But they
And I don't think other people should be saying things to him. That would be embarrassing. But that's something that's a good role for a coach to be playing. Be good target behavior. So gradiating sensory input away from whatever they're stuck on. So if they're stuck on Legos, doing something like Legos, but not Legos, to move away can help sometimes also. And then, again, practice getting unstuck rather than, you can't have snakes, you can't have Legos. We're just going to practice. We're not taking them away. We're just practicing no Legos.
So is him having snakes not help?
What?
He has his own snakes. So, I mean, is that not a good thing to have?
Well, I actually think that's great,
Oh.
because then he can go do his snakes. He's got them right there. That's fine. But, if your snakes live in your aquarium, in your room, go do your snake time. That's fun. I really need to go.
Thank you.
So, I hope this is helpful. Let me see if I can get to my, anyway, you can contact me through, most of you know where I am at Children's. You're welcome. And please feel free to email me.
Oh, thank you.
I
I have to try to tell the therapist that would be